Filipino nurses in the UK face tighter migration rules, possibly impeding new international joiners from the Philippines, resulting in a squeeze on remittance flows. Here's my report from London. Here in the UK, Filipino nurses are the backbone of the National Health Service, plugging critical staffing gaps in an aging country. Their service, in turn, sustains household consumption and growth in the Philippines through remittances. But new migration rules here is redrawing that map of opportunity. No one has felt these shifting winds more than May Parsons, the British Filipino nurse who became the first person in the world to deliver the COVID-19 vaccine to a patient outside clinical trial. Parsons, who has since received the George Cross Award from the late Queen, has set up the May Parsons Foundation to help Filipino nursing graduates and licensed nurses get into the profession.
The foundation then helps our fellow nurses, not just our nurses actually, all of our healthcare professionals, but even non-healthcare professionals comes to me and asks for support in terms of, services that can help them overcome any issues of burnout, of stress, of mental health issues. The focus is just to ensure that they get the services that they need.
We are more fortunate than we perhaps realize to have many thousands of nurses and other healthcare workers from the Philippines working in the United Kingdom, particularly in the National Health Service.
Fast forward post-pandemic, the UK's health and care sector faces tightened restrictions. New migration plans have reduced net arrivals, tightened salary thresholds, and curbed dependence on overseas workers in social care. Data from the Nursing and Midwifery Council show a near 50% drop in new international joiners in just 6 months. April to September 2025 alone saw the lowest intake in 5 years, with steep declines coming from the Philippines, India, and Nigeria as the UK shifted toward domestic recruitment.
But there's certainly been a big decrease in the number of what they call health and social care visas that have been issued by the UK government over the last 12 months or so, and that's deliberate policy tightening. And of course, a lot of this, would have been naturally to the benefit of OFWs.
The UK is consistently among the top 5 country sources of OFW remittances, after the US, Singapore, Saudi Arabia, and Japan. In percentage terms, the UK's remittance share is comparable to Canada and slightly below Japan. The U.S. still makes up the biggest share at over 40%. In the Philippines, staffing shortages continue to persist post-pandemic as nursing graduates find better paying placements overseas or end up taking higher paying non-medical jobs. Calls to raise basic pay of entry-level nurses languish in Congress. Bills at the Senate and House aim to raise compensation for Filipino nurses to between 40% and 74%.
Having more robust systems where there's a better streamline of how we're serving the populations that need health care and adjusting to that demand. If we consider the health workforce, the supply, and the population as the demand, then we need to make sure that the ratio is working effectively. And that becomes, again, as you mentioned, the governmental responsibility.
So Filipino nursing graduates find themselves at the crossroads between stricter UK migration rules and a staffing shortage back home in the Philippines. How then do we make the most out of the situation?
If we are able to sustain them here and keep them here, make them feel valued, give them the equitable pay, they will stay. So the UK has been the largest market for our international nurses, specifically for Philippines, in recent years, but that is because of the change in legislation again. I am hopeful that is still going to be changing because the amount of data that we're getting that people are saying that we still lack nurses in the front line is still enduring. Okay, so I'm hopeful that it's not going to be long until they'll start opening again with the recruitment.
Will Filipino nursing graduates still see the UK as their best opportunity? Or will they opt for more supportive systems elsewhere? Elsewhere could still include the Philippines, if and when policy support comes through. Reporting from London, I'm Kathy Yang. We are One News.